have obesity or are they going to be overweight? And it also projects that 42 million years of healthy lives are going to be lost because of different health or mental health issues. Now, in the areas, either educational or work, this also has a dip, 29% in women and 19% in men who will not be educated. Now, this means that they will be in a disadvantage, if anything. We cannot turn a blind eye to this. From the organism, the Andean organism of health, Hipólito Unanue, we're so committed to teens' health through our line for the defense of children and teens. And as we have shown over 5 decades now, we are trying to have the right to health independently of the different populations are going to be manifested. So this year, we reaffirm our commitment with the rights and well-being of all of the teens in the region through signing an agreement of a convention with the Confederation of Teens from Iberoamerica, Italy, Caribbean, and here. And also, I am very thankful to our speakers today, Dr. Bernabé from the WHO, Claudia Salguero, President of the Team Committee, and also Susana Guijado, who is President of the CODAHIC, and also all of the professionals of the second commission about health and well-being in all teams that are extraordinarily well represented here. Their knowledge and education are fundamental to be able to cover and to be able to confront all of the challenges that we find ourselves with this report. We'd also like to thank everyone who is connected through the Ministry of Health, academia, and civil society whose active participation enriches this space of reflection and commitment with the team's health. We're in Costa Rica. We're in a meeting for women and those that are pregnant, and this has been a priority. We've been speaking of teens that are pregnant and also global symposium for those that are Afro descendants. And we are completely sure that all people, regardless of any sort of characteristic that defines them, they all have the right to the best health possible, dignified lives, and happiness. So, from the Andean Commission of Health, Chile, Bolivia, Colombia, Ecuador, Peru, and Venezuela, together we are stronger, and together we will go further, especially in this commitment with health and well being in teens. Welcome to all.
Muchas gracias, querida doctora María del Carmen. A
Thank you
continuación,
very
le cedo la
much,
palabra a la
Mrs. Maria del
doctora
Carmen,
Sara
Dr. Maria del
Bird,
Carmen. Now we're going to give the
representante
floor
de
to
la segunda
Dr.
comisión sobre
Sarah
salud y
Bird.
bienestar adolescente de Lancet, quien dará el saludo
Now,
institucional
she
de
is from
parte de
Lancet. She's
Lancet.
going to give her
Adelante, querida
institutional
doctora Bird.
greetings. Go ahead, Dr. Bird.
Good morning and good afternoon, everyone. Thank you so much for the opportunity to welcome you today and for your interest in the Second Lancet Commission on Adolescent Health and Wellbeing. My name is Sarah Baird. and I am a professor of global health and economics at George Washington University in Washington, D.C., and one of the co-chairs of the Second Lancet Commission on Adolescent Health and Wellbeing. I will just provide a very brief introduction, and then you will learn more about the commission from a short animation and then a presentation by Dr. Prerna Banati, one of the other commissioners. This Lancet Commission represents the work of 44 commissioners that have worked tirelessly over the past 4 years to bring this report to fruition, as well as hundreds of others that have provided support, I'm sure many of whom are listening today. These commissioners span the continents, disciplines, and generations. We must remember we were all adolescents once, and for most of us, who we are today are shaped by things that happened during those formative years. Ultimately, our trajectory into adulthood and the lives of the next generation are critically shaped by our adolescent years. A decade ago, the 2016 Lancet Commission on Adolescent Health and Wellbeing helped bring focused attention to adolescence, a focus that then reverberated through key initiatives by WHO, UNICEF, and other UN agencies, work at country level, as well as academic initiatives. And there has been important progress over the past decade in sexual and reproductive health, education, reductions in morbidity and mortality from injury, and we must celebrate those successes. But despite a growing set of champions for adolescent health and well-being, such as those of you listening today, we are not where we want to be, and I believe we are at a critical junction. The decisions we make in the next decade are going to determine whether there's a bright future for today's young people and for the planet as a whole. This is why we feel that this second Lancet Commission is coming at the right time. While on the one hand, this feels like a very important milestone, this report is very much just the beginning. We now need to do the hard work to live up to its call for action. We very much look forward to the remainder of today's discussion and continued engagement with all of you. Thank you so much, and enjoy the rest of the conversation.
Perfecto. Luego de los cálidos saludos institucionales, me
Okay,
presento.
after this, my name is Ruiz Diaz. I am a health professional in public and global health. I am part of the technical team in the line of defense of children and adolescents in UNRECONI, and today I will be very happily in charge of moderating this webinar. Now, after this preamble, we're going to have a very brief introduction, as Dr. Bird had said, and this is a call to action in the Second Lancet Commission of Adolescent Health and Wellbeing, put together, as the title says, by the Second Commission of Health and Wellbeing for Teens. Go ahead, Rob.
Adolescents are the future leaders of our world. Ensuring their health and well-being now and into the future is key to building a just society and a thriving planet. But are we doing enough? As we move towards and beyond the Sustainable Development Goals, we must prioritize adolescent health and well-being. The Second Lancet Commission on Adolescent Health and Wellbeing has convened a global, multidisciplinary and multi-generational group to tackle this critical issue. This generation is facing unprecedented challenges, from climate change to digital risks, conflict and displacement. Today's adolescents are the first to experience lifelong climate change impacts. By 2100, 1.8 billion adolescents will live in a world projected to be 2.8 degrees Celsius warmer than pre-industrial times. The risks are real and rising. There has been progress, including reducing communicable diseases and improving education outcomes. But without increased investment, more young people will face declining health, with growing rates of obesity and mental ill health. Despite progress in some areas, our projections suggest that the SDG era will end with at least half of the world's adolescents, 1 billion, living in multi-burden countries where adolescents experience a complex and excess burden of disease. These will have lifetime and intergenerational impacts. Investing in adolescent health provides a triple dividend: benefits for young people now, for the adults they become, and for the next generation. Yet, global funding remains insufficient. Adolescents living in aid recipient low and middle income countries receive only 2.4% of total development assistance for health, despite making up 9.1% of the total burden of disease and representing a quarter of the population. Yet, there is hope. Education, economic growth, and digital innovation provide opportunities for even the most marginalized adolescents. School health initiatives and transformative public policies are paving the way for a healthier, fairer future. With the right investment and leadership and meaningful participation, young people can help reimagine a better world. For example, Bogotá, a city in Colombia, introduced traffic calming measures based on traffic data analysis and road inspections to improve student safety commuting to school. Nepal's National Reproductive Health Strategy included a specific focus on adolescents. It aimed to increase access to health services, including counseling. Critical for success, the policy incorporated the perspectives of adolescents. The First Lady of Benin has championed ending female genital mutilation and cutting, joining First Ladies from Burkina Faso and Niger in 2017 to condemn this practice. The investments made in this generation of adolescents will determine our human and planetary futures, for good or for ill. The time to act is now. Together, we can make it happen.
Excelente, teniendo una idea más clara del tema que nos convoca.
Excellent. Now, having a clear idea of what's bringing us together, we're now going into this task of contributing to the international analysis about the recent article of adolescent health and coming together for this call to action. Why we are now giving our first speaker, Dr. Bernardati, the floor. So she has a PhD in populational health, and this is in Cambridge. She has this as an investigator and an advisor for the United Nations and other international organizations. This included the generation and translation of different policies and programs that are inclusive and of quality for adolescents and young people. They're bringing a lot of experience for adolescents, gender, and social inclusion, and works extensively with government, civil society, and others.
En el Departamento de Salud Materno-Infantil y Envejecimiento de la sede central de la OMS en Ginebra. Antes de incorporarse
Now,
a la
before
OMS,
incorporating to the WHO, she worked 10 years in UNICEF,
central como
both in the central
entre
and in
2010 y
the field.
2012 fue
Between
becaria
2010 and 12, she was part of the committee in the University of Harvard and has worked previously in the World Fund Against AIDS, tuberculosis, and malaria, and for different NGOs while she was incorporating or she was in South Africa. Now, during her entire career, she has directed several different investigative programs, very high-profile action to health and well-being for teens. Is a member of several different councils, which are consulting councils, and has worked for different magazines and papers that are reviewed by pairs. She is a director of social challenges, and in 2018 was co-editor of the Oxford Handbook of Adolescent Development Research and its Policies. 2021 published Sustainable Human Development Evidence and Longitudinal for Adolescents and Youth in Philosophy. So please go ahead, Dr. Renati. This is your turn. Please take the floor.
Thank you so much, Ruby and the team. Thank you very much for your kind words and this invitation today. My name is Prerna Banati, and I lead work on research and guidelines for adolescent health at the World Health Organization, based in Geneva in Switzerland. And I'm really pleased to spend a little time today to share with you some of our reflections on the Lancet Commission on Health and Wellbeing. These 82 pages provide the most recent and comprehensive evidence globally for adolescent health and well-being that is available today. And I encourage you to read it. It's publicly available and can be downloaded very easily from its online source. The health and well-being of adolescents is one of the most important investments we can make for our communities, for our economies, and for our shared future. Today, there are 1.3 billion adolescents aged 10 to 19 around the world. And over the past decade, we have seen major progress in advances in their health and development. Thanks to expanded access to education, to improved nutrition, and reductions in communicable diseases, adolescent mortality has declined by 27% globally. As Sarah mentioned in the presentation earlier today, more girls are in school than ever before, and this is paving the way for greater gender equality and better life outcomes for millions of young women. However, serious challenges still remain. Non-communicable diseases, particularly those linked to poor diet, inactivity, and obesity are rising, as Dr. Mary Carmen Kaye mentioned earlier as well. Road traffic accidents and road traffic crashes are now the leading cause of death for boys from the ages of 15 to 19 years old. And mental health challenges have surged, with self-harm now among the top 5 causes of death for adolescents worldwide. All these issues in a complex world are compounded by harmful social media use and the lingering aftershocks of the COVID-19 pandemic. This is the world that adolescents are living in today. And girls in particular continue to face structural gender inequalities. Early marriage and early pregnancy continue to rob too many of their potential. Adolescents everywhere are increasingly affected by climate change, whether it's through displacement, through food insecurity, or the psychological distress of environmental anxiety. And the digital world. In the digital world, a new kind of divide is deepening inequalities. While some adolescents thrive online, many, especially in lower income communities, are locked out of access to health, education, and opportunity. And yet we know that when adolescents are healthy, educated, and empowered, they drive stronger economies, more equitable societies, and lasting peace. This is why investing in adolescent health is not just a moral obligation. It's a strategic imperative for achieving the Sustainable Development Goals. And the returns are immense. I'm going to share with you some of the evidence from the report. So we now have strong evidence that investing in adolescents is not only the right thing to do, but it is the economically smart thing to do. New analyses challenge the long-held belief captured in the Heckman curve that the highest returns on investment occur only in early childhood. In fact, the analysis shows that adolescence is now recognized as a second critical window of high-impact investment. Recent work using the marginal value of public funds, the MVPF framework, has shown that investments in adolescent health and education deliver returns that are on par with those for the younger children. In a recent analysis of 41 policies focused on adolescents aged 10 to 24 years old, more than 1 in 4 policies paid for itself over time. This body of work strengthens the case that adolescence is a high-yield period for public investment. When it comes to mental health, the situation becomes even clearer. Mental disorders are now the single largest cause of disease burden amongst adolescents, accounting for over 42 million disability-adjusted life years, or DALYs, in 2022, or 19% of the total burden. But beyond the immediate distress caused by mental ill health, we know that this shapes the rest of the life course for young people. In our review of 117 high-quality longitudinal studies, mental health in adolescence was found to predict a wide range of outcomes in adulthood, from physical health, education outcomes, employment outcomes, substance use in later life, relationships, and civic engagement. These effects extend into midlife, reflecting both biological processes and social pathways. In short, investing in adolescent mental health is an investment in lifelong well-being, in resilience, and in productivity. We also see lasting impact from education and social protection policies during adolescence. In our review of 175 studies, including 51 in low and middle income countries, removing practical barriers to education and providing targeted social protection, such as cash transfers, has long-term impacts into adulthood. These include improved employment prospects, better health, and enhanced gender equity. The evidence from Africa is particularly strong, with adolescent-focused education policies yielding benefits not only for young people, but also for their future children. In other words, these interventions offer a triple dividend, improving well-being now, into adulthood, and into the next generation. I'd like to take a moment to share with you some of the work that WHO is doing to strengthen adolescent health systems and scale up interventions that work at every level. Together with our H6+ partners, H6+ includes many UN agencies in an interagency model, we've developed the AHA, the Global Accelerated Action for the Health of Adolescents. This is our roadmap to build systems that are youth responsive, inclusive, and grounded in rights, covering mental health, sexual and reproductive health, nutrition, and more. We've also launched GAMMA, the Global Action for the Measurement of Adolescent Health, because we know that what gets measured gets managed. Schools are another crucial front, and WHO with UNESCO and other partners have developed a global framework for making every school a health-promoting school. It's a practical guide to make schools places of safety, of belonging, and of health. And perhaps Importantly to note, we are listening directly to young people in our work. In 2023, WHO launched its own Youth Council, a platform for youth voices to shape global health decisions, advise our leadership, and co-create initiatives that respond to their lived realities. As we look ahead, our commitment is clear. We will continue to scale up adolescent responsive health services as part of universal health coverage and to build systems that are fit for this generation and the next. So I would encourage all our partners to act with urgency, to act with ambition, and to act with unity. Because the choices we make now will shape not just the future of this generation, but of every generation to come. And with that, I thank you very much, and I'll hand back over to Ruby. Thank you.
Muchas gracias, estimada doctora
Thank
Perna
you
Banati.
very much,
Ella nos mencionó
Dr.
de
Brenna
forma
Manati. She
concreta
was
cómo
mentioning everything
cuán
very
importantes son
concretely,
las
very
inversiones
specifically, and how important
en salud
investing
y bienestar
in
de las
health
y
and
los
well-being
adolescentes,
of
al ser una segunda
teens
ventana crítica del
is. This is
desarrollo.
a second
De esta
critical
forma,
window
estas
of development.
inversiones
And now,
serán las
this way,
medidas
the
que permitan que la
investments are the
política pública
smarter
central en las
ways to
estrategias
be
que
able to
mencionó.
develop in public health. And
Tenemos las
through the
estrategias
strategies
de
that they've
promoción de la
mentioned,
participación
they
significativa
have the
de los
promotion of
adolescentes.
significant
Nuevamente,
participation
muchas
of
gracias por su
adolescents.
presentación.
So thank you very much
Doctora
for your
Banati, les
presentation,
invitamos
Dr. Vanati.
amablemente a
We'd like
permanecer en
to
sala.
kindly invite you
Han
to stay in the
llegado
room if
muchos
you'd like.
comentarios y preguntas
There are a lot
relacionadas
of
a
comments
usted
and
y nos encantaría
questions
tener sus
directed to
respuestas
you, and
al
we
final
would be
de
honored
nuestra
to
conversación.
have your
A
answers at the
continuación, damos
end
espacio
of
a la
this
doctora
in
Claudia
questions and answers
Sagredo,
part. So now we have
presidenta
Claudia
del Comité de
Sagredo. She is a
Adolescencia
president of the
y de la
Committee of
Asociación Latinoamericana
Adolescents
de Pediatría
of the
ALEP.
Latin
La
American
doctora Claudia Sagredo
Pediatricians.
Berrios
Dr. Claudia
es
Sagredo
médica
Velos is
pediatra
a
egresada de la Universidad
pediatrician
de Chile con
from the University
especialización
of
en
Chile,
medicina adolescente
specialization
de la
in
misma casa de
teen
estudios.
health.
Posee además diplomados en gestión de calidad de
Also
instituciones de salud,
has institutions of
salud
health that she's worked
y
with
violencia sexual
and working
y
against
derecho
sexual
internacional.
violence
Actualmente se desempeña como
and
presidenta
also
del Comité de
international
Adolescencia en
rights.
DELATE,
She's
como
currently
mencioné,
working in
y luego
Belate, as we have
asumió tras
spoken
ser
of.
secretaria ejecutiva del mismo
And now,
comité
this is
en
something that
marzo de
she's taken on
2022. Es
since
académica del
2022.
Centro de
Now,
Medicina Reproductiva y
she works
Desarrollo
in the
Integral
Center of
del Adolescente,
Reproductive
CEMERA,
Health for
de la Facultad de
Adolescents
Medicina de la
of
Universidad
the
de
Faculty
Chile,
of
donde
Medicine
desarrolla
of the
proyectos de
University of Chile, where
investigación
she
y
carries
docencia
out
en
different
temáticas
things
de
for
adolescencia,
reproduction,
educación y salud adolescente,
education,
tanto en
and
pregrado como en
adolescent
posgrado.
health, both in pre and postgrad.
Adicionalmente, ejerce como jefa de la
Now,
Unidad
she's
de
also the
Protección
chief of the Unit of
Infanto-Adolescente
Protection,
del Hospital
UPIA,
Roberto del Río,
the
una de las 3
Hospital Roberto
unidades
del Rio, one of
especializadas
the
de este
3
tipo en
units
Chile,
specialized
y trabaja
of
como
this type
pediatra
in Chile.
especialista en
And she works
adolescencia
as a
en la universidad,
pediatrician who is a specialist in
en
the
la unidad
unit
de adolescencia de la Clínica de
of
Santa María.
adolescents
Su
of the Santa
exitosa
Maria
carrera
Clinic.
profesional incluye haber sido directora
She has
de la
also been the
Sociedad Chilena
director
de
of
Pediatría.
the Chilean Society of
Asimismo, fue
Pediatricians
presidenta
and
de la
also
rama
the
de
president of
adolescencia de
the
FOCHIPE entre el
adolescents
2020
of
y
Ochipe
2022.
between 2020 and
Fue
2022.
consejera del primer
She
Consejo
was
Consultivo de
counselor of the
Defensura de la
first
Niñez de Chile durante el periodo de
defensors
2019 y
of
2022,
children and adolescents,
representando a la Sociedad Chilena de Pediatría
representing
en esta
Chilean
importante
Society
instancia
of
de protección de
Pediatricians in
derechos de
this
la
very
infancia.
important
Entre
part of
2020 y 2022,
infant rights between
dirigió el programa de
2022,
formación de
24.
especialistas en
Also
pediatría
worked with
general de la
specialists of
Universidad
general
Diego Portales y previamente
pediatricians,
trabajó
Diego
como
Portales,
médica
and before that she
especialista
worked
y
as a
académica
doctor
en la Clínica Aldalí
specialist and
entre el
academically in the
2018 y
Natalie
2022.
Clinic
Su
between
compromiso con la
2018 and
protección
2022.
infantil se
Commitment
evidencia
with
en su rol como creadora
infant
y
protection
encargada del
is part of
Comité
her
de
role
Protección de
as a
Niños,
creator and
Niñas y
also the one
Adolescentes
in
del
charge
Hospital
of the
Padre
committees
Hurtado
of Pedro
entre
Hurtado
2016 y 2021.
between 2016 and
Asimismo, ha sido delegada de la Confederación
2021.
de Adolescencia y Juventud de Iberoamérica, Italia y Caribe, CODAGIC, representando a Chile. Su experiencia académica se
Now, her
complementa con su participación como
experience
directora de múltiples diplomados en pediatría ambulatoria y salud
have
integral
been with
infantil, como
ambulatory
expositora en
pediatricians and
congresos nacionales e
health and in
internacionales
congresses,
sobre
both national
especialización.
and international, in their areas of
Finalmente, señora doctora
specialization.
Sagredo, es
Please
un
go
honor.
ahead, Dr. Sagredo.
Muchas gracias, Ruby, por esta
Thank you
presentación
very much,
tan
Ruby, for the
extensa, la verdad.
presentation. That was very extensive.
Antes que nada, quiero agradecer
Um,
la invitación
First off,
realizada
I'd
por
like
la
to
doctora
thank the
Maricel
invitation made
Carpenta
by
y
the
secretaria
doctor,
ejecutiva de
Javiera
Oratomo,
del Carmen,
y agradecer también el poder
and
compartir este
also
espacio
to
con la
thank
doctora Der, con la doctora
you
Banati, con
to
la
be
doctora
able to
Lijado.
share
Para mí es
this
una
with
gran
all of the
oportunidad
doctors.
poder
For me, this is a
participar en esta
great opportunity
oportunidad
to
con
be able to
ustedes.
participate now with you.
Me apareció, perdón, un mensaje aquí que no me queda claro.
I have a message here that I'm not really clear on.
Ok, pero ya lo
Okay,
solucioné.
I fixed that. So,
Yo quiero compartir
well,
un
I'd like to
breve
share a
PowerPoint que
very
realicé para hoy
brief
día.
PowerPoint that I made for today.
Es muy cortito, un poco para guiar lo que voy a conversar
I
desde
promise
la
it's very
mirada
short. It's just what we're going to talk
de
about from the
adolescencia y
point of
sobre
view of
todo en
adolescents
relación a lo que
and
el Comité de
mainly
Adolescencia de la
in
Asociación
regards to the
Latinoamericana
committee
de Pediatría,
in
donde
the
estamos
Latin American
reunidos
health and
más de 21
pediatricians.
países
And since,
con un
well,
mismo
from the
objetivo.
United States, we have
Realmente este
the same
informe
goals,
en el
really.
cual
And
voy a
this
participar
report
ahora ha sido un
of the Lancet about
excelente
teen
insumo
health
para el trabajo que
has
nosotros
been
vamos a
really
realizar
a
en los
lot
próximos 2 a 3
and is
años.
very productive of what we're
Además,
going to be carrying out in
como
the
recién
next
lo
few
mencionó la
years. And
doctora
apart from that,
Calle,
as Dr. Kaye has
vamos a
said,
trabajar junto con
we're going to be
y por
working together
supuesto
with the
junto a
HE
otras
and
firmas.
also together now with
Bueno, ya me
Otoscope.
presentaron,
Well,
básicamente
I have
es
now been introduced.
especialización
These are
y mi rol
basically
en este
my
grupo.
specializations and my roles so far.
A través de
And
este código QR
through
ustedes pueden
this
entrar
QR
a la
code,
sección
you
de
can
enlace
definitely
donde
go
podrán
in
encontrar
to the
este
Lancet where you're going to
informe
be able to find
de esta
this
segunda
report
comisión.
of this second
Pueden,
commission.
por lo tanto, hacer el
And
link a través de
so
sus
you
celulares.
can click the link through your cell
Y
phones.
quise, en
And
cierta medida,
I
traer a la
wanted
primera página
to
de los dos
bring
informes de los
the
cuales estamos
first page of the
haciendo
two reports that we're creating
presencia a través de este webinar, que es el
through
primer
this
informe de la
webinar.
primera
And
comisión
the
desarrollada
first
en el
report of this
2016
commission
y
developed
el
in
actual
2020,
informe
2016,
de la segunda
and the current
comisión
one of the second
desarrollado en el
commission that was
2025.
carried out in
Juntos
2025.
son
Now,
muy
these
interesantes,
are
realmente por
reports
la
that are very
cantidad de
interesting, especially
información
with the amount of
fundamentada,
information, which
todo
is
lo
fundamental
relacionado a
information,
un marco
and it
teórico
is something that is
profundo,
very
que
proved
se
and it
nota que
has
cada
theoretical
comisionado
framework that
está
is very deep.
abordando
Each
todo su
commissioner
compromiso
was
en lo que es la salud
giving their
adolescente,
entire
en lo
commitment
cual yo
in
principalmente
adolescent health.
destaco el trabajo unitario
And
que
I
realizaron
wanted
de
to highlight
participación, que
the
incluye, por
work that they've
supuesto,
been
la
doing of
participación,
participation, of course,
especialmente en
that
este segundo
included the
informe de
participation
jóvenes
on
y
this second
adolescentes,
report
10
of
en
young
total
people
de
and
los 44 que
adolescents, 10
participaron,
in total
en
of
los
the
cuales se
44 that
destaca
participating.
una integración
We
geográfica
have a
intrarregional y
geographical,
transregional,
inter-regional,
una
and trans-regional
integración
integration,
transdisciplinaria, transgeneracional,
transdisciplinary,
por supuesto,
transgenerational, of
basada en
course,
derechos y que al
based
mostrar
on
esto, por
rights,
cierto, un
and of course,
2016 a un 2025,
stating that
es
in these
sostenible en el
years,
tiempo.
this is
O
something that is
sea, la
sustainable
salud
in time.
adolescente está
Adolescent
presente
health
en este
is
informe
present
a
in
través de
this
los años
report
y
through
representando, por lo
the
tanto, décadas
years and
de salud
representing
y de
decades
trabajos,
of health
múltiples trabajos,
and
muchos trabajos,
multiple
en los
works, a
cuales
lot
realmente
of
hay
different
bastante
things that
información
we have a lot
sobre
of
la salud
information about
adolescente.
on adolescent health.
Yo solo voy a destacar algunos elementos de este
I'm only
breve
going to highlight
informe,
some
por el
elements of
cual
this report
ellos lo
through
denominaron
which
como un llamado a la acción,
they have
este
called
segundo
this a call
informe de
to
la revisión
action.
del
This is a
Lancet sobre
second
salud y
report
bienestar
on
de los y
Lancet
las
about health and
adolescentes,
well-being of
considerando la definición de
adolescents,
adolescente de 10
considering
a
the function of
24
adolescents.
años.
This is from 10 to
Los puntos
24 years of
esenciales
age.
que yo
Now,
establece es que
three essential
estos
points that we
jóvenes
have
de
here
10
are
a
that these
24
young people
años
from 10 to
son el
24 years of
porvenir de
age
nuestro
are
mundo.
the future
Nosotros
leaders of
cuando
our world.
envejezcamos, ellos
When
van a
we get
estar a cargo de
old,
todo lo que
they are
es
going to be in
este mundo,
charge of the
desarrollando sus
world,
habilidades y competencias,
carrying
y
out their
nosotros en
different
cierta
abilities,
medida
their
también vamos a ser
competencies, and
dependientes
we are
de
also going
cómo
to be depending
construimos
a
el
bit
mundo que
on how it is that we're going to be building the world that we're leaving behind for them. When we guarantee their health and well-being for the future, now this is really a mechanism to be able to have a collective future and to guarantee a more just, healthier, and productive world and future. Now, the investments that we're going to be putting in them is a triple dividend. What does this mean? They are going to have an effect on today's young people, about adults, and the ones that they are going to become, and also the following generations of children that they are going to be favoring their development and growth. Now, this evaluation that they're carrying out in this amazing report has a lot of fundamentals. Now, they conclude what I'm going to try and summarize very briefly on what they have established. Now, first of all, progress has been unequal. This not just within each country, but also within each region and in between the regions. Investment is still insufficient. This has already been said in the first presentation of the video. The truth establishes that 25% of the population of the countries of low and medium income are going to contain the new percentage of the mortality of these teens, but not only that. It's not just thinking of that as 25% of the total amount of the population. It is the total amount of the assistance destined to help. It's 2.4% of what is destined to help. And now the third point within this evaluation, this now establishes that the new threats, and they are growing with very limited opportunities. We know about climate change, the massive different transitions that we have as this organizations, and they tend to live in cities that are not planned, and this makes it more difficult to have opportunities. They have more odds to be in conflicts and to die in war. They have a higher proportion of those that are in refugees or in others, that the general population, the world economic surroundings that they have are difficult for them. Now, this is from 2028 and further along, and this isn't affecting them in the employment of teens. Many of the teens grow with high levels of poverty and inequality, and they have racism, discrimination, and it is more unequal, and also environmental degradation. Now, this report, what does this report offer? These are measures that I believe we have to review individually, but also on the influence that we can have on each one of the countries, and if possible, to be able to work together in measures which are also transnational or in the different countries, or hopefully we can reach even transnationally. The first ones establish these 7 points, which is have more accountability, have more financing, registering universal access to health, both primary and secondary school, reviewing and ensuring that the educational systems are incorporating together with the educational focus. This is for accountability purposes. And as a fourth point on commercial determinants of health, strengthening these policies that already protect health and the reproductive health, and also promoting mental health sequels, and to be able to guarantee health of the planet. Now, what happens with the fundamentals of how we're moving backwards in health? I think it's very important to consider what is happening. Why would it seem that in 2016 we have problems that are very similar to the current ones with very little advancement, or if anything, we're moving backwards. First of all, we're not aligned with the priorities and also the investments for teens. We have an inequality and it's persistent. We have weak implementation of policies, public policies. International financing has dropped significantly, especially these last times. Lack of confidence. We have hostility against the rights of teens. And we have the lack of cohesion after the pandemic and a lot of different global crises. We know that there is an insufficient data and monitoring. Not that there are no studies. This is per country and specific basis. And there's data that can favor, very specifically favor how to work with adolescents. Many countries don't produce disaggregated information, and so they lack the capability to have impact on these policies. Important to say that this report sustains that it's not about showing just the evidence of what works and what does not. It's just a lack of political will of sustained investment, intersectoral investment, and also commitment with adolescent participation. Now, these elements have provoked a loss of the impulse, of the push that we expected to have when we started in 2016. And also to focus, this is the area we work the most on, the situation of health in adolescents in Latin America and the Caribbean. Now, within the 2 points that I'd like to consider, we have the illnesses that, of course, are significant. We still have preventable ones, lesions. We also have homicide and organized crime, and we are within the regions that have the highest levels of homicides in males, high levels of adolescents that are within organized crimes, and they die because of that. Now, the use of alcohol, drugs, and the use of these are still high. Now, related to the structural and social factors, in 2021, almost 30% of female adolescents and 16% of male are not being educated. For 2030, we expect this to go up to about 30% in women and 22% in males. Finalization of 12 years of education is still low in 2021. Only 37% of males have finished secondary and 13% in women, although they do expect improvements towards 2030. But this is far from what we would have liked, or what we had expected, which was over 80%. Now, we had about 27 births for each 1,000 women in their teens, but now it's over 25. Now, this from 2030, it still goes further up than we would have expected. The access to modern and, well, birth control is not accessible, and now we also have marriages that are of young women, younger than 18 years of age, and this is very far from the goal that was to reach 10%. That is currently 25. And the fourth part, what happens to the policies and the institutional surroundings? They have developed national directives or strategies on sexual health, reproductive health, nutrition, education, etc. And page 14, wait, I'm sorry, I can send it later, but it shows that it has a high proportion of countries that have policies dedicated to adolescents.
la implementación y la equidad
in
de
sub-Saharan
financiamiento
Africa,
disponibles.
but
En
equality
relación
and others
especialmente
are
al
still
financiamiento,
challenges.
la financiación
Now,
para
in
sus
regards to
adolescentes sigue
financing,
siendo baja.
financing for adolescent health
En
is
América
still
Latina
very
no figura
low.
entre las
In
regiones
Latin
que reciben
America,
mayor
it is not
inversión
within the regions
internacional
that
para
receive
salud
any sort
mental
of
adolescente, a pesar del
international
aumento en suicidios y trastornos de ansiedad y
help
depresión.
for the avoidance of
Para
suicide, mental
concluir,
health
la verdad
prevention.
a
And
menudo
I'd like to conclude that
enfrenta
Latin America
desafíos
and the
significativos en la
Caribbean,
salud
we do
adolescente,
face significant
particularmente obesidad,
challenges in
salud
adolescents'
mental,
health,
embarazo adolescente y
particularly
acceso desigual a educación y
obesity,
servicios de salud sexual.
pregnancy,
A pesar de algunas mejoras en
death,
políticas en
mental
reducción del
health, and
tabaquismo y alcohol,
others.
los avances
Even
no
though
son
we have
suficientes para
improvements
alcanzar los objetivos del 2030.
in
Se
tobacco and
requiere un aumento
alcohol,
en la
this is not
inversión, mejor
sufficient. We
alineación
need
de
more
políticas con
investment. We
evidencia
need
e
to
inclusión real
align
de
different
adolescentes en la
policies for
toma
evidence
de
and also
decisiones.
the
Por
participation of
último,
adolescents in
solamente
the decision
considerar
making.
que cuando
And just to
estamos
close up
hablando
here,
del
that when we're
desarrollo
talking about
sostenible,
the
la
goal of
versión de Agenda
sustainable development
2030,
regarding
perdón, ahí
the,
me equivoqué al anotar la fecha,
I'm sorry, I was
tenemos que
mistaken
saber que
here
los objetivos
on the date,
del
but we
desarrollo de
know
forma
that the
directa se pueden
goals
encontrar en la
that are
ODS
developed
3,
directly that can
donde
be
se menciona
found.
adolescente en relación con
3,
salud
where we
sexual,
mention
VIH y
adolescents,
mortalidad, en la
we
ODS
have
5, donde menciona
HIV,
igualdad de género, donde aborda el matrimonio
AIDS,
infantil y embarazo adolescente, y en la
child
ODS 4,
marriage,
en relación a
teen
educación y calidad,
pregnancy,
donde
and
considera
we
la
have
disminución de la
quality
violencia
education where we include
escolar adolescente. Ahora, en forma indirecta, en
education
general está
and
dispuesto en
permanence
todos
for
los
children
ODS,
in
pero
their
además
education. I
cabe
know that
también
this
notar
is
en el ODS
mostly in
8,
areas that
donde
are
hay
more of
el concepto
poverty,
de
but
trabajo
here we
decente,
have
vinculado a
18 where we have the
juventud que no
concept of
desarrollan ni
decent
trabajan,
work,
ni tampoco tienen formación.
and we also
La
have those
ODS
that
10,
don't
donde la
study,
reducción
don't
de
work,
desigualdades crucial para
and
grupos
are not
adolescentes
actually
excluidos,
contributing
y
to
en
the
la ODS
population. And we
13,
have those that have been
donde está
excluded.
la
And
acción por el
from
clima
this
que
one,
conecta
we have
con la
action for
salud
climate that
pública y la salud
also
mental humana.
connects.
Finalmente, para terminar
Last but not least,
mi exposición,
to finish up
deseo
here with my
indicar
presentation, I would
que
like to just
debemos
indicate
fortalecer
that
las medidas indicadas por
we
este
have to
informe y
strengthen
mantener un
all of these
trabajo
measures in the
comunitario y de
report and to keep
participación
unit work and
relevante para adultos y
participation relevant
adolescentes en forma
to
interdisciplinaria,
adolescents,
con
both
un
in a
potencial
binding way and
multidisciplinario,
others with
transdisciplinaria
geographical
y
integration,
transgeneracional,
transdisciplinary,
basado, por
and
supuesto, en
transgenerational,
derechos.
based, of course, on
Y
their
que
rights.
sea sostenible en el tiempo, adecuándose al dinamismo de la situación de salud adolescente
And for it to be
y las
sustainable in
características
time,
específicas de esta etapa
together with the
dentro de la
characteristics of
proyección hacia
their
el futuro
stage
individual y
within
social.
the prediction
Por
of their
último, debe
futures,
mantenerse un
both
seguimiento de
individual
los
and
de los
social. And we have to
indicadores ya
contain
establecidos
follow up
y los que se
the
puedan
indicators
desarrollar
that have
en el
already been
futuro
established and
e
those that can be
inserción en las estructuras ya
carried out
existentes
in the
y
future.
validadas, como por ejemplo la Agenda
We have inequalities, for example,
2030,
in the
y
agenda of
vuelvo a decir, hay
2030.
un error en
Again,
mi
there
escritura,
is
¿ya?
well, there's a
Además
mistake in what I've written
de
down,
forma
but
urgente, favorecer
apart
la
from it
capacitación e
being
inserción
urgent in
curricular
creating any
en
sort of
educación primaria,
curricular changes in
secundaria
primary
y
education,
superior.
secondary education,
Me
and
refiero puntualmente es que está
higher
pasando
education.
con
No, what we're
las
saying is what
profesiones
is
relacionadas a
happening with
salud,
the professions
cuánto dentro de
related to
sus
health,
currículos está
how much within the
efectivamente hablando
curriculum
sobre
are
adolescentes.
truly
Ese es
speaking
un
of
trabajo que al menos en mi país,
adolescent
en
health.
la
That is work that,
universidad
at least in my
pública,
country,
estamos
in
nosotros en
public
estos momentos
universities, we
desarrollando
are
porque
at this
creemos
moment
que
developing
al
because we believe
socializar los
that
conocimientos,
when we
al hacerlos
socialize
mucho más universales,
knowledge, when we make it
también
much
en
more
forma espontánea
universal,
deberían irse orientando
we
las
should
nuevas políticas,
also be
pues
orienting new
nuestros
policies
jóvenes tienen
because
que aprender
our
de sí
young
mismos
people have
para
to
poder
learn from
también
themselves
influenciar en el
on
futuro
their
con
own to also
conocimiento
influence the
en
future with
accionar
knowledge
sobre los próximos
directed
jóvenes.
to the
También
next
incluye
young
los ramos de
generations.
acreditaciones e
Also, to
instituciones,
include them to
considerar que las
accreditations and
autoridades
generations,
deben
and to consider
permanecer
that the
con
authorities have
competencias
to
exigidas desde los
maintain
estados,
themselves with
entre otras medidas
competencies
ya establecidas e indicadas en este
already
informe. Por
established
último,
and
termino con
placed
la
in this
frase
report.
de
And I'm
este
going to be
informe donde dice que
finishing with the
garantizar
last
la
phrase of
salud y
this. It
bienestar
says
de los
guaranteeing
adolescentes
health and
ahora y en el
well-being
futuro
of
es el mecanismo
the
para
adolescents
salvaguardar
is a
el futuro
mechanism
colectivo de la
to
humanidad
make
y
sure that we have
garantizar
a
una sociedad
collective future in
más
humanity
justa, un
and to
planeta
ensure
más
that we have
saludable y
a
productivo.
fairer,
Muchas
more
gracias por la
healthy,
oportunidad, un
and more
gusto y saludo a
productive
todos los que
future.
están presentes.
Thank you very much to everyone that's present.
Muchas gracias. gracias por resaltar los importantes
Thank you for having
datos
highlighted
para
the very
nuestra
important
región y
data
proporcionar sus
for our region
importantes también
and
reflexiones.
also
Doctora Sagredo,
giving us your very
gracias amablemente por
important
permanecer en sala. Han llegado muchos comentarios y preguntas que nos gustaría
comments
tratar
and
de
reflections
responderlas
upon
lo más
this. We'd
posible.
like
A continuación, damos
to
paso a la
keep
doctora
you also in
Susana Guijarro,
this
presidenta
room
de
to
la
be able to
Confederación de
respond to the
Adolescentes
questions
y Juventud de
afterwards.
Iberoamérica, Italia y Caribe, CODAGIC. Ahora voy a intentar ser lo más breve
I'm
por
going
el
to
tiempo
try and make
con
this
su
more brief
presentación.
because
La
of the
doctora Susana
time.
Guijarro es médica especialista en adolescencia con
She's a
una
doctor
sólida
specialist
formación
in
académica.
adolescents with solid
Incluye una
academic
maestría en salud
formation that
pública
includes
obtenida en la
masters in
Pontificia Universidad
public health
Católica de
in
Ecuador,
La Católica
licenciatura
of
en grado,
Ecuador.
en educación sexual
She
integral,
has very
tiene,
integrated
tiene un
education.
doctorado en medicina
She has
y
a
cirugía de
doctorate
la Universidad
in
Central de
uh,
Ecuador.
medicine and
Actualmente se desempeña como
it's
presidenta de
specialized
CODAGIC
in
por el
teens
periodo
in Ecuador.
2024
She
al
is
2026
working
y
in
es docente
2024,
principal de la
2026 in Medellin, in Ecuador,
Universidad
and
Católica de
this
Ecuador
is
en
in
Quito.
the
Desde sus
University of Ecuador in
cargos más
Quito.
destacados se encuentra haber
Now,
sido
she's been
expresidenta de la
working, she
Asociación
has been
Latinoamericana de
ex-president of the
Pediatría,
Latin American
ex-líder del programa de
Group
adolescencia
of
del Ministerio de Salud del
Pediatricians,
Ecuador y
Ministry of
ex-líder
Health in
del
Ecuador, and
consultorio para
ex-leader
atención
of the
integral de
first
adolescentes de la maternidad y
hospital for
pseudoescuela de Quito.
adolescent
Ha
maternity in
demostrado
Quito.
su liderazgo en múltiples
She's shown her
organizaciones como la
leadership in
OPS, la
multiple
OMS
organizations like
y
OMS,
actualmente en
OPS,
CODAGIC.
and she's currently in Colegio.
Sin más,
Now, without
le
further
damos la más
ado,
cálida bienvenida a la
we'd like
doctora
to give
Guijarro.
her a
Tome el
warm
espacio, tiene 10
welcome.
minutos.
You have the
Muchas
floor. You have 10
gracias.
minutes. Thank you very much.
No sé si se está compartiendo la presentación, creo que no, ¿no? Bueno,
I don't
primero
think I'm
saludar a todas
sharing
las
the
personas que
presentation.
nos
First of all,
acompañan,
I'd
a
like to
todos
say
los
hello to
organizadores
everybody
de
that's
este
here and all of the
evento tan
organizers
importante.
of this event, which is such an important event.
Y quiero
And
compartir mi
I would
presentación,
like to
pero ya
share
es,
my
para mí es un
presentation,
poco
but
difícil
I am slightly
perfecto.
technologically,
¿Se ve la presentación?
I'm
Ah, ya,
not
porque yo
that
no la
savvy.
veo. Bueno,
I can't see the presentation.
Modo
presentación.
presentación. La copita. Donde está a tu mano derecha, lleva el cursor a la derecha, más. Ahí, regresa a la izquierda, ahí, un poquito, ahí. No, a tu derecha, donde está uno,
No veo, amiga, no me sale nada.
uno más, un poquito
Ahí.
más, un poquito a la izquierda, un poquito, poquitito, un poquitito más, un poquitito, ya, ahí,
No,
dale,
le doy clic, pero no me funciona.
a ver,
No.
Quizás pueda dejar de compartir pantalla y luego
Ah, ya.
intentar nuevamente. Sí.
Ahí.
We're having
No.
technical difficulties,
Ahora,
and they're trying to help her,
sí, voy a compartir modo
and
presentación.
I'm sure
Después
that
de eso,
this will be
regresar al
solved in
Zoom para
just
compartir pantalla.
brief moments. One moment, please.
Creo que ahí ya salió. Ya, muy bien. Disculpen, pero no veía. Bueno, la
Okay,
idea
I
mía
apologize. I
era,
didn't see
después de
this
todas las
before.
brillantes
But the idea
presentaciones, que
was,
ya
after
todos
all of
tenemos
the
claros de
brilliant
qué se trata
presentations that
este
were all
trabajo
very
tan
clear
importante
on what this very
realizado por la
important work is
segunda
about,
comisión
carried out by the
Lancet
second
sobre
commission,
salud y bienestar
Lancet,
de adolescentes,
about health
que
and
hablaba de
well-being in
atención, es un
adolescence, and
llamado
a
para
call to
todos y
attention.
todas
This is
nuestros
a call to
países,
attention to
que
all of our
tenemos
countries, really,
indicadores tan
that we
importantes
have
como lo hemos
indicators
visto
that are
y que
as
tenemos
important as
que
what we have
avanzar
seen, and we have to move
en
forward
este tiempo que nos
in
queda y
this
que
time that we have
tenemos que
left.
aprovechar lo que
And we
tanto
have to
se ha
take
hablado del bono
advantage of what we've
demográfico,
spoken
que en
about.
este momento tenemos una
Demographically
gran
speaking,
cantidad de
that we have a
adolescentes y
very large
jóvenes
amount of
que,
adolescents and young
pues,
people that
porque como ya
are,
se ha dicho y está escrito en
as
esta
we've
segunda
already
comisión, no
said, and
solamente son el
this is the
presente,
second
son el
commission, not
futuro y son
just
los
are they
líderes
the
para el
present, but they
futuro.
are the future. They
Entonces
are the
tenemos que
future
aprovechar
leaders. And so we have
este
to take
bono demográfico.
advantage
Yo
of
había
this
hecho un
demographic.
pequeño resumen de
So I
los
had made a
mensajes clave
small
dichos por la
summary of the
comisión
key messages made by the Commission, and also highlighting that it was made up of not just by experts in adolescence, but also especially by young people who were very actively participating. And this is one of the biggest challenges that we had, the work together with young people so they can get involved in the decision making. So here we have some key messages. As we were saying before, in teens, we have not just the present, but they are also the future for innovation, education, for defenders and leaders. The benefits of progress in infantile health, we have higher level of mortality, and our data, especially Latin American data and the entire African sector, are very important. So we have to take advantage and put the ideas and the capacities of leadership of young people to be able to reimagine and recreate a healthier planet for efficient actions, fundamental to have significant participation of adolescents in the policies, in investigation interventions, and also the mechanisms of accountability that affect them. They obviously require better indicators and better or improvements in systems. Now, this is something that's very important in this call to action because the majority of countries don't have the same indicators and we cannot compare and we cannot make evaluations on what our health systems are doing or saying.
Ay,
The slides are not moving forward.
No, no llega a pasar. Parece que está
Nope.
compartiendo otra ventana.
uy,
Entonces,
Dios mío, perdón.
quizás volver a salir
¿A dónde voy?
Okay, so we continue having certain technical difficulties
A ver,
and we
dejar
will
de
try
compartir.
again.
pantalla. Exacto.
Ay, perdón. Ahí. ¿Y ahora qué hago?
Volver a compartir, pero intente seleccionar entre
La
las
pantalla.
opciones. Cuando quiera compartir pantalla van a salir varias opciones. Seleccione la opción donde esté la presentación, el PPT modo presentación. Que se vea solo la lámina completa.
No, no.
Ahora está compartiendo toda su pantalla. Puede abrir PowerPoint.
Está abierto el PowerPoint, pero no sé cómo
Puede
compartir.
compartir la pantalla. Quizás pueda enviarnos su presentación para nosotros compartir desde acá.
¿Les mando por WhatsApp?
Sí, por favor.
Ya, perfecto. Eso mejor voy a hacer.
One moment, please. We are solving some technical difficulties.
Le mando a Yadira, ¿cierto?
Sí, por favor.
Ya, gracias. Bueno, yo creo que vamos a perder mucho tiempo y más bien les voy
I
contando
feel
lo que
like we're
tengo.
losing way too much
bien?
time. So I'm just going to tell you what I have.
¿Me la pasas a mí?
Ya, déjame ver. Ya, déjame ver.
Sí, pásamela.
Well, I will see.
Ya.
Okay,
Denme un segundito, por favor.
so just 1 second, please.
En todo caso, para mí lo más importante que quería resaltar de este documento es eso que había dicho, ¿no?
Well,
Cómo
the first thing I
logramos, se
wanted to
logró
do is in this
ah, que
document, the first
un
thing
muy
was that we were
importante
able to,
sector de, de científicos y de adolescentes. Y más que nada,
well, this is from scientists and teens and
bueno,
well,
quiero resaltar, les decía, no logro
well,
pasar, pero bueno, lo que quiero
I
resaltar es también los desafíos, ¿no?
am
Que
not
nos
able
hablan
to
aquí
do
en la
this. When
comisión
we're talking
de
about
una
challenges
falta de
here, it's basically a
liderazgo mundial
commission, a
y
lack of
voluntad
leadership
política,
in the
una
world
escasez de datos para
and a
establecer
political
objetivos y
will.
monitorear el
We
progreso,
have to
evidencia
establish and
insuficiente
monitor
para el diseño
progress,
de
evidence
intervenciones
which is
efectivas y
insufficient
específicas para el
for all
contexto,
of the
una escasez de
specific things that we have
trabajadores,
to do,
investigadores y
a
defensores
lack of
adecuadamente
workers
capacitados,
and
equipados y
defenders that
apoyados,
are
que es uno de los
adequately
problemas más graves en
trained,
nuestro
which is
país.
one of the
En mi
worst
país, en
problems
Ecuador,
that we have in our country. In
logramos,
my
como
country, in
ustedes saben,
Ecuador,
capacitar a
in
muchos
we're able
trabajadores
to,
de la salud y sin embargo
well,
con el cambio
train
de
several
gobierno
different health workers,
se
but with the
reubica toda la
government,
gente y se pierde
we
todo
are
el
now
esfuerzo que
placing all of the
se
people and we
necesita recursos
lose the entire
financieros porque
effort.
actualmente son
We need financial
totalmente
resources
inadecuados y
because
una
they're completely
coordinación que sea
inadequate
eficiente
and
entre
a
todos los
coordination that
sectores.
has to be efficient in all of the
¿Cuáles son
sectors.
entonces las acciones que
Now,
nos
what
recomienda la
are the
comisión, la
reactions then,
segunda
or what is
comisión?
what are the
Crear
commission,
enfoques
the second
propicios
commission
para transformar
actually
la salud y el
suggests?
bienestar de
They say we
adolescentes,
should
ampliar las
transform the
acciones
health
dentro de los
of
sistemas
teens and
existentes
others,
para abordar la
expand what we
salud y el
have to be
bienestar de
able to
adolescentes,
cover the health and
desarrollar
well-being of all
enfoques
teens,
innovadores para
to
abordar
develop
amenazas complejas y
innovative
emergentes para la salud en
things
colaboración
for health
siempre con
in
adolescentes.
collaboration always with the
¿Cuáles
teens.
son entonces los
Now,
objetivos
what are
generales?
then the
Primero,
goals, the
crear
general
entornos
goals? First of
propicios
all,
para
to be able to
transformar la
create
salud y el bienestar
environments
de
to be able to
adolescentes.
transform health
Segundo,
and
ampliar las
well-being of
acciones dentro de
adolescents.
los sistemas
Second,
existentes para
to
abordar la salud y
expand
el bienestar
these
de
existing
adolescentes.
systems
Y
of
tercero,
well-being for
desarrollar
adolescents
enfoques
and teens, and
innovadores
also to be able
para
to
abordar
develop
amenazas complejas y
innovative
emergentes
focuses
en
to be able to
colaboración
cover
con
emerging
adolescentes y
threats
jóvenes.
together with adolescents and young people.
Quería también hacer énfasis en lo que nos
I
habla
also wanted to
la comisión de las
emphasize
acciones
on what the
necesarias para
commission was
mejorar el
saying, on the
bienestar de
actions
adolescentes.
necessary, but to
Y en el
improve the
marco del
well-being in
bienestar de
teens.
adolescentes se
In a
articulan
framework
5
of
aspectos
well-being,
fundamentales, que
we
es el
have
primero,
5
salud y
different
nutrición
things that
óptimas,
are important. Health,
conectividad, valores
optimal
positivos y
health
contribución a la
with,
sociedad,
well, optimism,
seguridad y un
contribution to
entorno
society,
propicio, cuarto, el aprendizaje,
safety,
competencias,
and,
educación,
well,
habilidades,
learning,
empleabilidad,
competencies,
y quinto, autonomía
employability,
y
and
resiliencia.
also
Este
autonomy and
enfoque, lo
resilience.
más
Now, this
importante creo que
focus,
es que
the most
sitúa
important
la
thing I
salud
think
dentro
is
del
that is it
bienestar, que es un
situates health
enfoque
within
diferente
well-being,
a
which
la
is a different
definición
focus
original de salud de
from
la
the
OMS de
original
46, que
definition
sugería
of
que la salud
ONC from
era sinónimo
46, and
de bienestar.
that thought
Ahora el
that
enfoque
health
es
was
que
a
la salud
synonym of
se sitúa
well-being, and now
dentro del
health
bienestar.
is within well-being.
Nuestros adolescentes hacen mucho
Now,
activismo
our
político, especialmente
teens
en
do a
nuestro
lot of
país.
political activism, especially
Creo
in
que
our
en los
country.
últimos años, a
I
partir de
think
la
that
pandemia,
in the
menos,
last
pero es
years
otra
after the
cosa que
pandemic,
tenemos que
less, but
impulsar
this
y
is still
retomar,
something else that we have
porque el
to
activismo
promote and
político
take
de
on because the
adolescentes se ha centrado en
political
la ecología,
activism
la
of
guerra y los
teens is centered
conflictos,
in
la justicia
ecology,
social, la
war,
igualdad de
and,
género y la
well,
preocupación
others,
por la desigualdad
social
económica con los rápidos avances en las tecnologías
justice with the
digitales
rapid
que han
advancements in
permitido un nivel de
technologies. These
comunicación que
things have allowed
impulsado
us with
una
their level of
participación
communication
sin
and that has
precedentes.
promoted participation that has had no precedent and give us 11 different indicators in reproductive health. I have a lot of emphasis on indicators because I think that is what we lack the most in our countries. What are the indicators? Is it the age in which they first have sex, or the age in which they have the marriage, HIV, vaccination against HPV, mutilation, and ablation, partner violence, sexual education, and different sexual policies for teens? And so we have to take into account that with the reports that we have with each and every one of the countries and on a global level, especially with these policies, there has been a lot of difficulty to continue with these programs on sexual and reproductive health. And so it is something else that we have to take into account. And last but not least, I wanted to take the participation of these young people into account. They have to be involved more than just in health. We have education, justice in the private sector that also involves us. We usually work in the public sectors, and we have to reform the services that already exist, including what we already have, in particular in scholarization and how it is given, especially in terms of mental, sexual, and reproductive health, using the platforms and technologies as a transforming thing to be able to involve young people and adolescents and young people. And we have to value this and their participation and contribution and how this could help us to be able to promote change. Now, financing, we've already spoken a lot about this, but it's very important for well-being. On a world level, we know that health and financing, they do not actually cover their purpose. In general, is very low, and financing available is not very centered on the needs or destined to the specific needs of every age and gender. And so it's very important to be able to prioritize, apart from the support to the very vulnerable teens, emphasizing support in teens, those that are pregnant, mothers, and those that are more prone to gender violence. I wanted to highlight this in the prevention of pregnancy in adolescents and also the responses. That is my presentation. Thank you very much. Thank you very much for your very relevant reflection. We've had some technical difficulties, but the messages that have been shared very clearly. We would like to invite you to stay here. We have a lot of comments and questions for you, and we're definitely to be able to have a dialogue with you about these things, of this feedback. So next, we have, again, giving the floor to Maria Avila, that is there from Brazil, Dr. Maria del Carmen Gallo, continuing with the entire presentation of her.
Tiene un amplio abanico de organizaciones en las que ha contribuido. Entre ellas podríamos mencionar, además del ORASCONU, la International Pediatric Association, el International Association for Adolescent Health, donde ahorita es presidenta electa. Fue viceministra de Salud Pública del Ministerio de Salud del Perú en 2018. También previamente fue directora general de intervenciones estratégicas en salud pública. Ha tenido experiencia profesional en la OPS Washington. Ha tenido también puestos de presidencia y liderazgo en la Sociedad Peruana de Adolescencia y Juventud, en CODAYIC. Asimismo, debido a su amplia trayectoria e impacto, ha tenido reconocimientos en el ámbito de la salud pública. Por ejemplo, en el 2021 recibió del Ministerio de Salud del Perú la condecoración de la Orden Hipólito Unanue en el grado de Gran Cruz, que es la máxima distinción que puede recibir un profesional de salud pública en el país. Bien, he intentado ser lo más breve
Now, I've
posible.
tried to make it as briefly as
Así
possible.
que le damos el más cordial
So
paso
now
a la presentación de la
we're going
doctora
to give the
del
floor
Calle.
to
Le
the
damos el
Dr.
agradecimiento
Del
y
Calle. We'd
10
like to
minutos.
reiterate our thanks, and it is only 10 minutes for the presentation. You can tell that you work with me because of the entire presentation. Thank you very much. Well, first of all, this was the idea. The idea was to present the Lancet report on adolescent health, and I'm going to make some comments about the report. Now, first of all, this is a call to action. This is a call to commitment. In other words, we really have to continue working for the health and well-being of teens. I just wanted to say a couple things. You see, in this report, we consider adolescents from 10 to 24 years of age, and we're talking about a report in a world with a lot of changes. First of all, it is the cut, the largest cut. This is the largest amount of adolescents that we've had in history. It's one of every four. It's 25% of the population of the world are adolescents. We're talking about climate change, tendencies changes. We're talking about mental health. We're talking about a lot of different things. And the most important thing is that we're talking about a deficient investment. We're only investing 2.4% for a population, which is one out of every four people. So of course, there are risks and there are opportunities. Risks, we have more and more illnesses, which are non-transmittable illnesses, and we have already been told this, and we have obesity, which is something very, very important. We have millions. We have 42 million that are going to be obese in the next few years. We also have this problem about climate change, and this was also mentioned. Also, well, climate anxiety. But we know that climate change makes people migrate, change, and this is a problem that none of us are free of. The other thing is about digital transformation. Now, this is very important. And we're talking about that digital, well, it's positive because we have it here as a risk, but also all of the digital innovation is good. But there's also cyberbullying, addiction to games, basically addiction to internet. And we also talk about commercial issues, which Claudia was talking about, marketing and everything for adolescents and young people and everything that is included within their lifestyle. When we're talking about this, we talk about a big problem. We have it in the entire world, which is migration. We're talking about 7 or 8 billion people in the world. We have 1 billion that are moving around. We're moving around internally and externally by economic development. Yes, of course, but as always, it's not equal. And digital innovation that is helping to have more of the population to be integrated into the, let's just call it the doctor teleconsultations, and again, in a world that is very unequal. And so, what Susanna said was very, very important. This is a well-being issue. We have always discussed it is not just health, it is well-being, and obviously health is within well-being. And so, what do we need? We need to have access to resources. We need the development of capacities because there is a triple dividend that we've already spoken about because there is an intergenerational impact. And because definitely investments are important. And I always say adolescents are not the future, they're the present. That's the right too, because whatever we invest adequately is going to depend, the future is not just going to depend on them, it's going to depend on us too. And so to be able to achieve the well-being of adolescents, we need investment in health and well-being, but we also talk about accountability. And that is called rendición de cuentas in Spanish. And not having data is not an excuse to not do things. If we have data and we have more and more formalized data, and if we have more and more on levels that are linked to gender, ethnic, disabilities, everything, this is part of intersectionality. We're talking about having better decisions when we have the data. We cannot not speak about multi-sectorial coordination. This is something that's repeated a lot, and this is something that we've been repeating for decades. Protection and empowerment, health and empowerment and all of this, and obviously participation of the teens themselves. This has been 10 commissions, but it's been based on an entire group of work with 124 different 124,000 teens on a world level. We have those from Ecuador, Latin America, and one of the highest rights that has more deficiencies is participation. We say that games are for children and participation is for teens. So we need effective participation from teens to recognize the value of their contributions, to ensure that their ideas are applied, and to be able to co-create agendas, to be able to cover challenges, to develop abilities for them to have a structural capacity, and also to have policies and directives that make it so that this is really going to have a presence or not. In Orascon, about 3 years ago, that we carried out a study. We published it in an OPS, and it was about how the rights of children and adolescents in Peru, Colombia, and Chile have been moving, but there's still a lot to be done in regards to participation. Now, in regards to sexual and reproductive health, I'm going to say a couple things. There's something that's very important. It is discrimination, and this is for, sexual orientation, uh, couples, the lack of legal protection, conflicts, services that are not adapted, restrictions on different barriers of essential access to health services, access, which is very limited to sexual education, and also all of those that are for sexual and reproductive health. And we cannot not mention the inequalities, gender inequalities in adolescent health. And so, what are the conditions that are key conditions, which are obviously, according to statistical and academic and others, that are part of sexual orientation and gender equality? Because right now we're in a world of diversity, inclusion, equality, and we have to take all of this into account. And also sanitation. We need resources, human resources that are competent to be able to respectfully tend to our entire population, not those that are aligned with what they believe are the correct or incorrect genders. What we need is that in the curriculums of the universities, we need to incorporate teens in a more robust way and speak a little bit about non-transmittable diseases or transmittable diseases in adolescence. This is very important, vital. We know that anxiety and depression has gone up. We know that suicide has gone up. And of course, we also know that there are several different things that we can do about this, but we're not doing it. We don't have clear data we know that the data that we do have are minimal percentages, and definitely we still do not have this within our medical salud to ask about mental health in adolescence. And we know that 40 or 50% of all of the mental illnesses start in adolescence, and they need timely help. About obesity, we've already mentioned this. We already have a crisis on adolescent obesity. Obesity is an illness. It's not just a risk factor. It is an illness, and we have to cover the comorbidities. This issue regarding the weight and obesity, we have a policy, and this is definitely, of course, related to lifetime and healthy development of teens. Where we have to be is in schools. There's where we can promote healthy food, and we can do this if there's production, if there's availability, if there's food, if there are no myths. So this is also a determining factor about health. And here we're not talking about covering all the determining factors. And in determining factors, we have many. Let's just remember that health services is only 20-25%, and that we have a lot of other determinants that are still not things that we've solved in our region, because our region, sadly, we have to repeat this a lot, but it is very unequal. And so it is the one that has the most inequality. And we have to also have more mental health. This is a world emergency. I think that one of the most affected populations are teens. This is something that is said in the report, and of course, this is something that we also all recognize, and we have to reduce the amount of these illnesses. And what they're proposing is this: it's areas that are free of conflict, because what we have is obviously we have to be able to reach positive peaks, not just the absence of war and conflict, but also allowing everyone to be able to develop adequately. We also have this report and has us think about, work. What are they going to work at? And what are our teens going to work at? We're talking about green technology, digital and economical innovation, renewable energy, to be sustainable agriculture. And what is the idea really? Here, we still haven't really placed it. And I'm sure it says it in the report somewhere. But we have science, technology, engineering, and maths because, well, yesterday we were walking around and we had a school here in Costa Rica that the STEM had turned it into STEAM. It had added art because art is also very important. And so, what's the idea? It's for teens to have these kinds of training and abilities for employability. And many a times, our schools, our colleges, they don't prepare them for this. And they really do need it for the future of their employability. Now, on the other hand, we cannot not speak about the inequality, intersectionality, um, gender inequality. We have, you know, disability, racial, and we had the in symposium Afro descendants and other things. We have inequalities, which are socioeconomical ones, that's already been shown. Less and less people are rich, and more people are poor. And speaking about strategies for public health based on data, actual data, let's remember that to decide, you have to have data. And one cannot measure what you cannot see or define. You can't improve on what you can't measure. So, of course, the indicators are of vital importance. And to have good indicators, what do we need? We have to have analysis. We have to have good data that will turn into good information. And the need of disaggregating data, not just men, women, but also where they live, what is their socioeconomical reality, what is their identity. Let's talk about perhaps if they are an ethnia or not. And obviously, to follow up the indicators and to try. You know what? Try? No. It is an obligation. We have to understand the illness load and how this will be influencing our decisions on a local, regional, national, and of course, international world level. Just some very specific things. I'm sure we've said most of them already, but I just think we're going to be talking about a couple. We're talking about the assistance sector. There's a lot to say. Right now, I would like to invite you to read the report. If you were to compare it with the previous one with 2016, the large difference is mass participation of teens, and they speak about different contexts. They talk about digital aspects. If you want to look at teens, you have to make sure that you talk about everything in adolescence, United Kingdom, what is influencing them. We also talk about marketing, how everything influences the commercial aspects, and climate change, which is really dragging the entire world down, and all of the conflicts that are being carried out in the world by so few people. And we can clearly see that we are still not achieving the necessary investment to truly have health and well-being for all of the teens without an exception. And so, what are these challenges and recommendations specifically? There's a lack of integration in teen health, in medicine, and nursery. Well, only 30% are directed to adolescents, and they're theoretical without any sort of training on communication or anything. And well, I studied medicine several years ago, but we still had the pediatrician course, and I remember that more or less we talked about adolescents one day and pediatrics a couple months. And I've asked my companions this question, and they've said more or less the same thing. So what's the proposal here? We have to update the curricula. This is something that we started in the International Pediatric Association because we need to integrate mandatory things about all of the rights and all of the careers for health just to begin with. And this is also something that is very important in the International Association, the IAAH, because we have realized in the world meetings that we definitely are not incorporating health and well-being of adolescents in the pre-grade as we should. Now, assistance focus based on certain illnesses, psychosocial, for example. Adolescents are divided between pediatricians, between adults and others, and without anyone who is really trained for the transitions. And this is in a world level, and in all of the countries we try. I'm going to speak as a pediatrician. Pediatricians should see teens until their 20s. We usually only see them until they're about 12 or 13 years old, and then they're derived to subspecialties. And what is the problem? That at this moment, we have more teens with chronic illnesses. And this is definitely the transition that gives us spaces for specialties that are not necessarily pediatricians or internal medicine. These are specialties towards the future. We need an interdisciplinary focus with psychologists, social workers, doctors trained on, well, in adolescence, if we have to have them in the larger hospitals, and not at all, but in the big ones, and in practical training. Mm, some things that are standardized, and rotation in specialized services. Now, with the World Organization for Health, we have worked in the group on a world level, and we have two very important documents that are coming out. One is the standardization of quality in the adolescent services, and the other one would be the core, the basic principles, the basic characteristics that the professionals and technicians should have, those that tend to adolescence. Now, this is an update of the previous document, but I believe that this is something that is fantastically put together. The um, Health Organization, together with IAH, in coordination with many different institutions, and with the active participation of adolescents in those opinions. Now, these documents, I think that, I mean, I'm almost sure, but then we're going to make public in the Congress of the International Association for Adolescent Health in Jamaica. And the third challenge, cultural barriers and prejudice. This goes against confidentiality and autonomy of teens in general. And so, for example, a lot of professionals ignore laws about confidentiality, the process, due process, without parents, especially about those that have to do with mental health, sexual health. And what about standards for quality? Well, what we've already spoken about with Claudia, and also we have certified professionals in different systems that are agile for monitoring, influencing national indicators about the access, quality, and equal access. Now, we've been working on this for several years. We started in 2007 with our first proposal with a plan of the prevention of adolescents pregnancy, and we're at the third update now, right? I think we 6 months. In 2017, we had the committee, which was the prevention of pregnancy in adolescents. This turned into the Committee for the Integrated Health with an emphasis in preventing pregnancy in teens. And from the Andean Organization of Health, we've prioritized and we have placed a line. And we made this a reality. We have congresses, we have yearly congresses for adolescent health, we have yearly congresses. We've been able to carry out different workshops together with the OVS and the Peruvian Society of Health and Youth. We have worked to 2030. We have updated all of the information about reproductive health, sexual health, and we have mental health congresses every year. Now, what does a report say? Come on, action, right? I mean, we don't have to convince ourselves of this. We're all convinced of this already. We have to have political incidents because there's one thing that says without any budget, there are no rights. And that is true. The day that we recognize that health of teens has been able to position itself the way it deserves to be positioned, it's going to be where not only 2.4% of the budget is for the 25% of the population in the world. And well, we will continue working. And thank you very much for your attention. I would like you to please read the report if you can. There's a mention of successful things, right? As experiences of teens activism, a lot of things, well, several different transfers, or even monetary transfers, which are definitely related to delays of pregnancy in teens. There are a lot of positive things there. We should share them, and we should try to make it so that health and well-being in teens to have the place it deserves. Now, for this presentation, I would like to thank the Andean Organism of Health and Ruby, who helped me to make this presentation, and Gloria, who's right next to me, who is the one in charge of health in teens in the Andean organization. Thank you very much.
Muchas gracias por su
Oh,
ilustrativa
well, thank you
presentación
very
y
much
la
for your
visibilización de
presentation,
las
a
experiencias
visualization of the
sociales en el Perú.
experiences in the
Estimada
Andean
doctora Galle,
area.
han llegado muchos comentarios y
We
preguntas
have
que
a
queremos
lot
hacer,
of comments and
y que
questions
definitivamente
for
nos
you,
encantaría poder
Dr. Akaya, and we would
responderlas.
definitely love to hear your
Tras
answers.
estas enriquecedoras
Now, after
ponencias, nos
these
tomamos
very
este espacio
enriching
para agradecer a todas las personas y representantes de
presentations,
países
we'd like to thank
que
all the people
han
and the
sido parte de la
institutions that have
invitación.
been part of the audience,
Países que han estado conectados han
countries
sido
that have been
Argentina,
connected, have
Bolivia,
been Argentina,
Brasil,
Bolivia, Brazil,
Colombia,
Chile,
Costa Rica,
Colombia, Costa
Cuba, El
Rica,
Salvador,
Cuba, El
Guatemala,
Salvador,
Honduras,
Guatemala,
México,
Honduras,
Paraguay,
Mexico,
Perú,
Paraguay,
Uruguay
Peru,
y Venezuela.
Uruguay, and Venezuela.
Así que nuevamente muchas gracias.
So again,
Hemos
thank you
recibido
so
gratos
very
saludos y
much.
felicitaciones.
We have had congratulations, we have had our
Iniciar este
salutations,
diálogo
and
a partir de las
just to
preguntas y
begin the
comentarios,
dialogue
los
with the
ponentes, por favor,
questions,
enciendan sus
everything,
cámaras.
we could
Como
please
ya saben,
turn
hemos
on our
recibido
cameras.
mucha
As we know,
retroalimentación
we've had a lot of feedback,
y por temas de
and
tiempo no vamos a poder
because
responder
of
todas,
time, we're not going to be able
pero
to answer all of them, but
estarán
we can try
pendientes para
and put some together
poder
and also
guiarnos
have
en la
some that
siguiente
are going to be
presentación.
pending to guide us in the next presentations.
Bien. La primera
Good.
pregunta va a
Okay,
la
so the
doctora
first
Bernarda
question would
Banati.
be for Dr. Bernabana.
El informe proyecta que para el 2030,
The report project for 2030, 464 million adolescents are going to have overweight or obesity. Now, from the perspective of the strategies, intersectorial strategies, they're more urgent to be able to cover this epidemic. So that sounded like a comment.
So thanks so much. Thank you. I'll just reflect a little bit on this question around intersectoral approaches to think about overweight and obesity prevention. Ruby, I hope I understood it correctly from the translation. So I can mention a few things of interest. One is we're working closely thinking about some of the commercial determinants of overweight and obesity. We know that the food industry in particular has an important role to play in marketing food and beverages to young people. Young people are very empowered, but at the same time developmentally need suggestion, need support in the decision-making processes around food and beverage consumption. And I think given the developmental sensitivities around it, the marketing of these sometimes unhealthy products, sugar-sweetened beverages, for example, in school settings, cause a significant problem and contribute to these types of outcomes. So I think collectively with the private sector, we need to look at addressing some of these commercial determinants for overweight and obesity. The school platform, as I mentioned in my presentation, the school platform is a very important one for looking at these intersectorally, looking at school health in particular, health promotion and physical activity, the reduction of sedentary behavior. So, not being on screens all the time, but being active and moving around, really important for young people, and not just for their health today, but for their lifelong health. And so really thinking through the role of school and health promotion within school settings to take a whole school approach includes physical activity, proper health promotion information around healthy eating, explaining the important roles of parents and other teachers in supporting young people to make sound decisions for their health. Really important. Thanks so much. Back to you, Ruby.
Muchas gracias por su respuesta.
Thank
Hay
you very
otra
much for your
pregunta que
response.
podría ser
Now, there's another
dirigida
question that
a
could be
los
directed
tres ponentes, a la
to the
doctora,
other three
Claudia, la
speakers,
doctora Susana, la doctora
Dr.
María del
Claudia,
Carmen.
Susana, Maria del
¿Qué
Carmen.
experiencias exitosas en la
What
región
successful
busca
experiences
dentro de sus
have you had in
organizaciones
the
podrían
region
escalarse
or
para
in your
mejorar su acceso a
organizations? Could you
servicios
scale up to have better
para
access to
adolescentes en
health
situación de
for
vulnerabilidad?
adolescents that are in a situation of vulnerability?
Quizás podríamos comenzar con la doctora Sagredo.
Maybe
Claudia
we could
Sagredo.
start with Dr. Claudia Sagrego.
Perdona, no podía liberar el micrófono.
I'm sorry, I couldn't
Eh,
unmute my microphone. Okay,
Yo
so
creo que en
I
relación
think
al
that
informe,
related to the reports,
hay claramente como experiencias
there are
exitosas en el
clearly
informe, como por ejemplo en relación a lo que son las
successful
políticas nacionales
experiences. For example,
específicas para
national policies,
adolescentes,
which are specific
estoy
for
hablando
teens.
especialmente de la
We're
región.
talking
En
about
muchos
these in the
países han
region.
desarrollado
In a
políticas
lot of
nacionales
countries, they've
sobre
developed
programas
national policies
específicos
with
como foco de
specific
salud sexual,
programs
prevención de
about
violencia, de salud
sexual
mental y
health,
nutrición. ¿Ya?
mental health,
Es
nutrition,
importante
etc.
porque
And
también están
it's important
alineadas con
because these
planes
are also
multisectoriales y con
aligned with
compromisos de derechos humanos.
multi-sectorial plans
¿Ya?
and
Pero
just
la
human rights.
implementación
But the
y el seguimiento
implementation,
a seguir
and that's where
por
all the
regiones son muy
buts come.
desiguales. ¿Ya?
The coverages
Además,
are very
dentro
unequal.
de
And
las
within a
zonas del país
country,
y
within the
además
areas
entre los
of the
países también
country,
de
and
la zona
amongst
latinoamericana y del
countries,
Caribe.
the Latin America
Hay
and
una experiencia
Caribbean
bien
regions,
interesante que son
there
las de
is
integración de
experience,
madres y
or there are lacks
adolescentes
which are important.
que en su
We
etapa
have the
escolar
integration of
no
adolescent
ingresan al programa
mothers.
establecido para
We have
favorecer su
some even to come back
reingreso.
into
En
certain
Uruguay, en
programs.
Brasil, yo tengo entendido que sí, eso se ha establecido muy bien.
So we have
Por lo
established
tanto,
this
eso
fairly
también es
well,
una
and
buena
so this is
práctica
also good practice,
y con grandes logros.
and
¿Ya?
it has great
En
achievements.
relación al matrimonio
Now,
infantil,
related
también el
to
tema de la prevención del matrimonio
child
infantil
marriage,
también se ha avanzado en
prevention
varias
of
regiones.
child marriage,
Hay
we have moved
reformas
forward
legales
in
para
several different
establecer
regions. There are legal reforms
varios
to
lugares
establish
que le dan mínimo
this in
edad
several different
los
places,
18 años hacia
and
arriba.
it is a
¿Ya?
minimum of 18 years of age.
También es importante, está viendo acá
That's
dentro del
also
proyecto como
important, and I can see it
varios
here.
países
I
como
have it
República
written down
Dominicana y
that several
Dominicana
different countries like
aprobado
Dominican
líneas
Republic
al
and
respecto,
Honduras
¿ya?
have
Al menos
approved
desde el
laws about this,
2017,
at least
¿ya?
starting
Y eso yo creo que es
2017.
una buena
And
práctica
this is
replicable
something that I believe that this is a
dentro de las
replicable
otras
good
buenas
practice.
prácticas que
Well,
también
within the other good
están en servicio
practices we
legal
have
en
as
este
well, we
país.
have
Yo me
the
muy
different
orgullosa, por supuesto,
services
para
here. I'm very
adolescentes, porque
proud.
Chile es uno
But
de
we
los
have
países,
Chile, one of the
Colombia, muchos otros
countries,
también, que han
Colombia, Mexico
establecido
as
estos
well, that
servicios
have established
a
these
nivel más
services
de los
on
servicios públicos,
a
por supuesto,
level which is more a public,
enfocados a la salud sexual, la salud
and this
mental y
is focused on
prevención de consumo de
sexual
sustancias.
and
Son equipos
other
multidisciplinarios con
different
espacios diferenciados,
things
horarios
that allow
diferenciados,
us to
participación
have
juvenil
differentiated
activa,
schedules
vinculante en la
that are
planificación y el
activated, and these are
desarrollo y cómo se
linked to
desempeñan dentro
planning
del
and
espacio.
development and how it is that they
También
carry out in
dentro de
these
los
spaces.
programas
Now, within these programs,
juveniles,
young
se
people's
han implementado
programs,
consejos
we have
consultivos de
implemented
adolescentes o
different
parlamentos, también le llaman
councils,
juveniles,
different
con
parliaments,
distintos
we also call
niveles
them
de
parliaments,
institucionalización.
with different levels of
Recordemos que en nuestro país,
institutionalization,
dentro
specifically
del
in our
ministerio,
countries. Within the
hay distintos
ministry,
niveles.
we
Por ejemplo, en
have different
Chile, en
levels.
el
We're talking about
Ministerio de
Chile.
Salud
We
hay
have
un
the
consejo
Ministry of
consultivo de
Health. We
salud
have a
conformado por
consulting
jóvenes
one of
y que
health
se
that is
hace
made up by young
permanentemente
people,
anual,
and
están
they have
dirigidas y por lo tanto
yearly
están
meetings that are
integrados a la
directed
estructura y tienen
towards
elementos
and
vinculantes
directed
también,
for
¿ya?
these structures.
A ver,
And
dentro de los
let's see. Within the multi-sectorial programs, I can say that Peru, Brazil, Argentina, there are experiences to social protection and other protections with emphasis in preventing any sort of teen pregnancies. And I would say that there are a lot of good practices. And I think that we should expand on these and to share them because
podemos nosotros avanzar como
we could
región,
definitely
¿ya?
move forward
Como
as a region
similitudes como región,
because of the
anexiones tenemos,
similarities in the
comunes en todas
regions.
las regiones, yo eso lo
And
tengo
an
muy
annex,
claro,
we have
y
them in
también
common in all of our
promover
regions,
la
but also
interculturalidad, que yo creo que
to
eso
just
sería muy
have
importante porque
this
nos ayudaría
integration that would be
a
very
poder
strong because it would
dialogar
also
con cada
help
uno de
us
los
to be able
países.
to
Eso puedo como
have
aportar.
more
Muchas
work
gracias,
done in each and every
Ana.
one of our
Em,
countries. That's what
quizás
I could
como
say.
para detallar, una
Well, perhaps
experiencia
I
en
could
particular,
detail an
por el tema de
experience in
tiempo tenemos que
particular.
ser
Because
breves,
of time, we have to be very brief,
una
please.
experiencia
Um,
particular, además de
one
lo
very
mencionado por la
specific
doctora Claudia,
experience
que
from
podrían
what has been
resaltar de
mentioned
sus
by Dr.
organizaciones.
Claudia that could be highlighted by their
Creo que
organizations.
lo más importante en
I
estos
think that the
países
most
es
important
que a
thing
través
in
de
our
los
countries
organismos
would
que
be
estamos
that
trabajando
through the
conjuntamente, la Misión
organizations
Andina
that
de
we
Salud,
work
ALAPI y
together
PODAQUI, hemos
together with
logrado
API and PIDAKI, we
coordinar
have been able to
especialmente en las guías para
coordinate
atención integral de
these
adolescentes,
guides
que nos
for
hemos
integrated
apoyado
assistance in
mutuamente y
teens. We've
tenemos,
supported
por
each
ejemplo, la
other,
historia
and
clínica
we
es la de
have, for example,
OPS, que en
clinical
varios países
history
la
in
hemos
the OPS
adaptado,
in
pero
several countries. We've
el
adapted
sueño es que
these,
cada
but the
adolescente
dream is that
latinoamericano,
each
de Latinoamérica y tal vez
Ibero-American
del mundo,
teen
tenga su
in the
historia
world
clínica porque
can
ahí
have their clinical
se
history
pueden
because
detectar
there
riesgos
we
antes
can detect
y hacer
risks
intervenciones oportunas.
beforehand and
Entonces yo
have
creo que ese es uno de
opportunistic.
los éxitos más
So
importantes que
this is
hemos
one of the
tenido
things that we
como
have
trabajo conjunto a
identified
nivel
as
de
the most
Iberoamérica
important
y el Caribe.
together as Ibero-America and the
Muchas gracias,
Caribbean.
doctora Susana. Adelante,
Thank you very
doctora
much, Dr.
María.
Susana. Go ahead, Dr. Maria del Carmen.
Bueno, ya casi dijeron todo, ¿no?
Well,
Pero
I mean, I think
Colombia
everybody said
tiene
almost
un
everything, but Colombia.
exitoso programa
Colombia
que
has a
la diva,
successful
su
program,
señora Diva Moreno,
and
fue un
this
exitosísimo
was directed
programa
by Diego
con
Moreno. They had a very
redes
successful
juveniles en toda
program
Colombia
with
y que todos
young
participaban en
people's
una
networks in
prevención del
all of
embarazo
Colombia.
adolescente.
And there was just the avoidance of pregnancies,
Integración, servicios
also
ambientales,
Chile
consejos
with
consultivos
integration,
también disminuyó.
council,
Perú también
Peru,
disminuyó. Lo que
also it
nosotros
went down.
vemos
What
es
we
que
see
hay una disminución en el
is that
embarazo en
there
adolescente de 13 a
is
15
less
años.
and
La diferencia es que
less
ha aumentado de 10 a 14.
pregnancy
Entonces,
from 15
definitivamente
to
hay
19. The
violencia
problem
que
is that
tenemos que
it's gone up
mundo,
from 10 to
que
14
todos
years
los
of
medios
age.
de
There
enfrentar.
is
Pero yo
violence
quisiera
that we
decir que
are
este tema es
trying to
multisectorial.
confront,
Este
but
tema
this
es
would be a
multisectorial y
multi-sectorial
multidisciplinario.
issue,
Y la respuesta de cada
multidisciplinary
país será
issue. And
enfrentar
truth be
con las
told,
nuestras
this
autoridades
has to be fought when
locales, regionales,
our
nacionales,
local and
tenemos
regional
que
and
darle la
national and
importancia al
world
adolescente, la importancia que tiene. ¿Qué queremos? Así como luchamos porque estén
authorities
usted
actually
educado,
fight.
protegido,
When we
saludable,
find that
que
they're
pueda decir que
educated, they are
participa, que
protected,
sea
they're
tratado
helped, they
justamente
participate,
desde la
well, they're
Convención
treated justly and everything. That's what they
Internacional de los
say, right?
Derechos del Niño.
The convention
Recordemos que
of
la
their
convención es
rights.
hasta
They
los
say
18
the
años
convention
y que
is up to
también
18 years
la
of
Comisión
age, and that
Interamericana
we
de los
have an
Derechos de la Mujer es hasta
inter-American
los 29.
organization
Entonces,
of young people, and we go to all the way to
eso es
19.
lo que
So
yo
that
quisiera
is
compartir en
what
Colombia
I
y
would like to
también en
share. We
Pediatric
have been able to
Association. Hemos logrado
have
que
an
cada
international
pedida
pediatric
pase
association.
como
We've
un
been able
test
to
de
have
embarazo
them
más.
going
Una cosa que
from
estamos
1,000
haciendo.
days
¿Cuánto
to
tiempo, Susana,
1,000
Claudia, las que estamos en
weeks.
este
Susanna,
en
Claudia,
este
all of us,
servicio público
Gloria,
de
those of
cuidar a
us
esta
that are in this
población?
business, how long have we been
Tiene que
fighting for
haber una
this?
continuidad, ¿no?
And
Yo
so
como
this
profesional,
continuity,
pero también tengo que acompañar al
I
adolescente.
mean,
Otra cosa
yes, I could do
exitosa,
the little
otro
thing, but also I have to accompany them.
si tú
Also,
tienes
transfer of
transferencia y
money.
pones
I mean, if you
condiciones,
put a
pues
transfer
claro,
and you put conditions,
si la niña
I
va al
mean, it's
colegio,
to
¿no? Si
show,
la
to
niña
see if the
deja de ir al
child goes to
colegio,
school and they don't
definitivamente mi
stop going to
condición
school.
es
And
mejor.
then, of
Por
course,
ejemplo, un
it
tema
would be
muy
less. But
importante es salud mental.
something very,
¿Y
very
qué pasa
important
con
is
salud mental?
mental health.
Claro,
And what happens with
en nuestros
mental health?
países, en nuestra región,
In
puedo hablar por
our
región andina,
region,
hay
in
países que no
our
están tan
countries,
adelantados en todo el tema de salud mental. Y en Chile
The ones that are the ones that are the most advanced in mental health are Chile and Peru, because we have services that are directed, but we lack the other countries. Because I want to end this by saying we have to have a focus on the course of the entire life. You don't become obese from one day to another. You become obese little by little. I mean, let's remember epigenetics. We are the result of genes, what we were given, and the environment. And this is shown. Ruby, you always say this. This is shown. This is proven that during adolescence is when, well, it's just a lot of influence everywhere. And so I think that there are several different experiences that are successful that could scale up, but without a budget, there is no right. And without any sort of accountability, then there's also no rights. So that's it. Thank you very much, doctors. Dr. Prada is no longer here because of the agenda, but I would love it if you could leave us 3 messages that you consider key messages to finish your introduction. I would say in 1 minute, but I know that it's hard. Claudia, Susana, we're both running to the airport, so I'm sorry, we do have to leave. We're gonna have to disconnect. We'll listen, but we can't talk. Sorry.
Para mí lo más importante es
Well,
lo que
for
había
me, the
dicho,
most
¿no?
important
Tener
thing is what I had already
comunes
said.
agendas
To
comunes,
have
que
common
todos tengamos las
agendas,
metas claras y que
for
sean
all of us
comunes,
to be
como había
very
dicho,
clear on our agendas, for there to be in
las
common
historias clínicas,
the history, the
las
clinical
guías
history,
de
the
práctica clínica para
guides, the
atención integral
practical
de
guides
adolescentes
for the
son
integration of
básicas y ello
adolescents,
implica no solamente lo
basic.
biológico,
And
sino más que
this
nada lo
is not just
psicosocial,
biological, it's
lo sexual
psychosocial.
y la salud mental que
Sexual
tanto
and
énfasis hemos
mental
hecho.
health is,
Porque
which is what we're put so
esos
much
son dos
emphasis
temas que
on, because
nos
these
están
are the
causando
issues, the
más
subjects that are
daño a nuestra
causing us
adolescencia y juventud en nuestros
and causing
países.
our
Que
adolescents
decir
and
la
young
violencia,
people
todo el
the
enfoque de
most
género y
damage.
esto, ¿no?
All this
Entonces,
violence,
y
gender
motivar
focus,
especialmente a
motivating
universidades, ya hemos hablado
universities and
también sobre
others.
eso, para que
You've already
incluya
spoken
en
about
su
that as well,
currícula la
to
temática de
include
adolescencia, que
this
es
theme
básica, ¿no?
regarding adolescence, which is basic,
Entonces,
right? And
eso creo que es
so
lo más
that, I
importante a
think, would be the
resaltar.
most important thing to highlight. Go ahead, Dr. Claudia.
Yo creo que lo hemos dicho todo,
I think we've said everything.
pero para mí el estar aquí con ustedes
But
es una muestra
for
de que
me, being
trabajando
here
en
with you
conjunta
is
realmente es lo que
just
permite
showing that
crecer.
working together
Y
is
yo
what
quiero
is
hacer
truly going to
énfasis
help
de
us
este
to move
trabajo que la
forward.
verdad,
I would
como
like to
decía la
highlight this
doctora
work, as
Calle, la
Dr.
doctora Jarro,
Gaye
el doctor
and Dr.
Doctora,
Howe, all of the
es un
doctors have
proceso que
said,
viene ya hace bastante
this is a
tiempo,
process
¿ya?
that has been
Pero la idea
ongoing,
es que sigamos
but the
fortaleciéndolo
idea is
porque
to
la salud
continue
adolescente es
strengthening
muy
it
dinámica y
because
necesitamos en el fondo
teen
trabajar en
health is
conjunto
very
y
dynamic.
establecer
We
indicadores
have to work
comunes
together.
y
We have
podernos
to
orientar
establish
en forma
common
conjunta.
indicators,
Así
and
lo
we
quise
have to
hacer este
orient
webinar,
them.
que lo estamos haciendo en conjunto,
And
en forma conjunta,
just the way we're
y
doing it
poder
now,
entonces
doing it
responder
together, and
adecuadamente
to
a
be
la
able to
salud de los
respond
adolescentes, teniendo
to
presente
adolescent
que
health
hay estudios
adequately,
que dicen que el
taking into
programa
consideration
a
that there are
todas se
studies
aplica
that
en
say that for
adolescentes y
every
adultos
dollar
adolescentes,
that is
se
invested
devuelve
in
alrededor de
teens,
5 veces más.
you get about
En la niñez se
$5
dice entre
back.
7 a 13
In
por los estudios que hay, 7 a
children, you
13
get from
dólares,
$7 to
pero en los
$13
adolescentes
back.
también hay
But
una retribución
teens,
si lo queremos
there
ver desde el
is
punto de vista
also a
productivo.
retribution if you
Agradecer la
want to look at it
oportunidad
as a
y a
productive
todos los
way.
que han visto esto
Thanking
les
you
digo
for
que
this
todos vamos a hacer
opportunity, for everyone
el
has seen this, and
trabajo
thank you,
para
Ruby,
hacer
for
que
all
esto
of the
podamos
excellent
coordinarlo.
work,
Un gusto.
for all of us to be able to
Muchas
coordinate
gracias
and come
a
together.
los
Thank you
ponentes,
very
a los
much.
participantes,
Thank
a
you
los
for all of the
recursos
speakers, all of
disponibles
the
también.
participants that have seen us.
Sin más, cedo la palabra a la
And
doctora María del Carmen
I'm going to
Calle
give
para el cierre de
Maria del
este
Carmen
webinar.
Calle
Muchas
the floor
gracias.
to close this
Por favor,
webinar.
doctora.
Please go ahead.
Muchísimas gracias, Ruby. Bueno, mis primeras
Thank you
palabras
very
son de
much, Ruby. Well, my
agradecimiento.
first words
Berna se
are
tuvo que retirar,
thanking
se despidió.
Berna.
Berna es una luchadora
She
por
did
salud en
leave.
adolescentes. Los
She
invito a
fights
leer
for,
el manual de
well,
Oxford
health
de
in
2007.
teens. I
Realmente es obligatorio para
really
lo
like
que
you
hacemos
to
adolescentes.
read the manual of Oxford. And also, I'd like to invite you all to Jamaica, to the International Congress, that we're going to be presenting these new guides so you can connect. As Susanna has said, they will be adapted to each reality, but we're talking the same language here. We have on the one side the APE, which are the pediatricians, that we really have to insist on them looking or being able to cover teens. And we have CODAHIP, which is multidisciplinary. And we have really been working on this for several years. Andean Organism for Health, but just specifically, without a budget, there are no rights. The only way that we are truly going to be able to measure progress is when we have, this is what Prana said, when we have an actual budget. This is what her entire program has been about. We need more investment in health and well-being. And this is the really big thing, right? I mean, we're talking about well-being, not just health. It's education. It is protection. It is to be connected. And there are things that we haven't even spoken about that I think that are very, very important. Everything that is happening now, which is very, very, let's say, thick. It's a little scary, really, but we can do this. But we cannot not speak about being alone. We have the surgeon study, we have the WHO study, and one of the stages that are the most affected by loneliness is adolescence. So we have a debt with our kids, and we have to continue working. In the Andean Organization of Health, we commit to continue working together in coordination with APE, with CODAHIT, to be able to make the future, not just the future, the present and the future of our teams, for them to be better and better. So we'd like to invite you to our next webinar, July 15th. This is a webinar which will be at 5 p.m. together with the International Society of Pediatrics and the Rights of Children and Adolescents. And we're going to talk about violence, children, adolescents of the International Society of Social Pediatrics, which is at 5 p.m. And June 19th, we're talking about the World Report of Population. So we're going to be sharing the population. Now, this is with the United Nations, of course, and with Dr. Alejandra Corral, which is the regional director. For us, the Andean Organization of Health, it is a pleasure. And we're very proud of the fact that more and more global institutions are reporting in our spaces. This is the 5th year. We are now 5 years carrying out webinars. And what was the idea? To learn together. And as Susana and Claudia have said, let's keep moving together, moving forward for our teens and kids. Thank you very much. See you soon. Goodbye. Thank you, Ruby. Thank you, everybody.